Chapter 13, Part 2. We're going to pick up from the last slide talking about finger sticks for children older than the age of 1. Again, we do not perform a finger stick if the finger is swollen, edema, cyanotic, or infected. This is an image of collecting blood from a toddler. Used when larger quantities of blood are needed, we would perform a routine venipuncture. The veins of the antecubital fossa or the forearm are the most accessible and are chosen for most toddlers and children. Other sites used for venipuncture are the median wrist, the dorsum of the foot, the scalp, and the medial ankle. This gives you anatomy of veins in a baby's arm. Venipuncture is indicated for blood sampling for routine laboratory tests, ESR, blood cultures, cross-matching coagulation studies, and drug and ammonia levels. The procedure for performing venipuncture on older children is similar to that of adults. Special consideration may include special preparation of the child and parent, assistance in restraining the child, and the use of special pediatric-sized needles such as a 23 butterfly or 25, and safety wean infusion sets. Scalp vein venipuncture. Scalp veins can be used on infants when access to other veins is difficult or undesirable. 23 gauge safety weaned infusion set is used for venipuncture, as shown here. Scalp vein venipuncture. Position the needle at a low degree of angle over the vein in the direction of blood flow. This would be the same premise as when we draw a hand, so 15 degrees or less. Puncture the skin and slowly advance the needle until blood begins to flow into the tubing of the needle set. This is collecting blood from a central line, which we reviewed in Chapter 15, but I will go over this in class. This is an IV placed in an infant. We just need to be aware that they might have a special wrap around it to protect the device from the child taking the IV out. The next part of Chapter 13 is going to talk about geriatric patients. The geriatric population uses 31% of the nation's healthcare services. By 2025, the elderly population will have reached over 20% of the total U.S. population. Increasing geriatric population in the United States, the number of elderly citizens is rapidly increasing because of the advancing age of the baby boomer generation. The elderly population is increasing and will demand more health care. The elderly physical conditions that we need to be aware of are arthritis, Parkinson's disease, and Alzheimer's disease. And in these circumstances, there is special approaches we need to take as phlebotomists in order to obtain blood samples. And I will go over these in detail in class. Increase in point-of-care testing by skin puncture due to difficulty of obtaining blood by venipuncture. The increase in point-of-care testing in homes, nursing homes, and other long-term care facilities allow us to obtain a small amount of blood, which would be less invasive for our geriatric population when necessary. Increasing numbers of healthcare workers will be necessary to provide care in the expanding numbers of the healthcare facilities. Physical problems common in older individuals. We got to look at loss of taste, smell, feeling, memory loss, hearing loss, failing eyesight. And these all take into a consideration when we're going to draw their blood, because the patient may not be able to hear exactly what we're asking them to do. They may not be able to read the tube. The loss of taste, smell, and feeling is really essential, because if we were to hit a nerve, they may not be able to feel it. And memory loss could be an issue when we go to identify our patient correctly. Normal changes of aging, as diagrammed here in the image. Body fat increases in the trunk, brain loss, some axons and neurons, high frequency hearing loss, visual changes, arteries stiffen in blood, oxygen levels decline, maximum breathing capacity in lungs also decline, and muscle mass can decline rapidly without exercise. Some other physical problems common in older individuals: skin tissues become thinner, making venipuncture difficult, and muscles become weaker, affecting the angle of the venipuncture penetration. Increased susceptibility to axial hypothermia is also a consideration with this group. So we got to make sure that they are have appropriate blankets nearby if need be to prevent hypothermia. Increased sensitivities and allergies are also other physical problems the geriatric population might experience. Elderly patients use about a third of all healthcare services in the United States, so a lot of our patient population in phlebotomy setting is our geriatric population. Emotional problems associated with aging, the loss of career, spouse, close friends, or relatives can be reflected by depression or anger at life in general. We got to be compassionate to these patients and realize that this is a part of life, and that when they need support, we need to provide them the best services we can. Consideration in home care blood collection. We might need extra supplies, equipment needed, positively identify the patient. Special positioning of the patient for venipuncture. We may not have a specific draw chair. Use hand disinfectants before the blood collection and wait for the puncture site to stop bleeding. Especially important in the geriatric population because they potentially might be on blood thinners that causes their bleeding coagulation rates to change. And properly discard all trash and used supplies. You're going to label specimen and place them in leak-proof container with the biohazard sign and check the appropriate temperatures for transportation. And we're going to document if there's delays in delivery. That will conclude Chapter 13. I will cover the additional materials on HealStick, assessing geriatric patients in class on lecture day on Monday or Tuesday.